Sure. So once we're convinced that the patient's an appropriate candidate for opioids, Charles, give me an idea, how might we choose between an immediate release or a more rapid onset analgesic?
So I think we've covered that already, and I'd like to expand upon that. I think you've just really highlighted the importance of developing a therapeutic relationship with somebody. And you just highlighted, Mark, the fact that no matter how carefully we practice, we will be bamboozled by some. And I think it really takes a combination of time and effort and general as well as physical evaluation to get a sense of what are the needs of the person. And I think that we need to be familiar as providers of care with the tools that we have. So if it becomes clear that the long-acting regimen the person's on for example, and you made this point earlier about sometimes getting rid of the intermediate. I think that's a really, really great point. Why, if you are somebody on a really good long-acting regimen and they have those bursts, flares, breakthrough pain episodes upon a background of well-controlled baseline pain, you don't really need to use two. Why would you do that? The pain's there, it needs to get arrested, so to speak, immediately. Use an immediate release product to get it done. Get it right the first time, as Billy Joel says.
Sure. Yeah, you know, what I've heard my colleagues say in the past before is that, you know, Charles, you broke down before that there are different types of breakthrough pain. And for those spontaneous, hey, my pain goes 0 to 60 in 2 minutes, that's where they say, hey, let's use the more rapid onset opioids. But if they know they're going to sit in the car for a doctor's appointment and that 30-minute drive is going to exacerbate their pain, maybe perhaps that's where they could preempt with the shorter and characteristically less expensive generic immediate release agent.
I mean, we complicate things by asking, I think we complicate things by asking the patient to be able to clearly distinguish which drug do they need this time.
Sure.
And maybe in some ways it would be safer to streamline it to the one that's going to get the job done quicker.
Vitaly, are there certain types